everything works within the context of it, the way that it's set up. And so with any kind of holistic medicine, it's very similar to physical therapy, to personal training. You know, if you went to the gym one time and then you thought, oh, that I'm going to be in shape, well, you know, you've got another thing coming. You know, this is part of a process. When you don't have a relationship with somebody, then there's a feeling out period. You know, oh, let me just try this once. Let me just try this twice and see how it goes. And just like anything, you know, nothing really works that well. If it did, then no, there wouldn't be any other form of healthcare. If all you had to do was one treatment, one pill, you know, one medication, one surgery, and then no recovery, and it didn't matter because it was all just fixed, then none of us would be doing what we do. Everything works within the context of it, the way that it's set up. And so with any kind of holistic medicine, it's very similar to physical therapy, to personal training. You know, if you went to the gym one time and then you thought, oh, that I'm going to be in shape, well, you know, you've got another thing coming. There's a process of retraining the way that your internal workings are optimized, the way that your organs are functioning at the highest level, the way that your energy is optimized, the way that your emotions are even and, you know, kind of and joyful. Those are things that have to be, you know, retrained into your body, because most people, when they come to us, they have gotten to a place where they're on this side of the line. You know, they're already over. And so we're literally pushing to get the thing back just to a baseline. Now the retraining starts, and now we're building in that. While we're building in resiliency, we're literally retraining the way blood is flowing to a region, the way that your organ is functioning on a day-to-day basis, how well your digestion is working, how well your liver is detoxifying your blood. All those things get optimized out here. They don't get optimized over here. This is just helping you feel better and get to the point where you're not miserable. Now we're optimizing over on this side. You see what I mean? And so that's and if you don't have a relationship with somebody, it's very hard for them to get to kind of, you know, connect with you on that. You know what I mean? Because in the West, we are raised with this idea that if it hurts, it's bad. If it feels better, it's good. Nothing else is needed, right? And all this kind of, you know, concept of optimization, people don't relate things like working out and nutrition to the same way that they relate to medicine or health care. You know what I mean? It's lifestyle and then it's medicine. And what we try to do is really combine those two things. And we have a lifestyle medicine. That really is what this is. So, you know, the thing with multiple modalities is, you know, we don't tend to start thinking of additional modalities until we have, I'm speaking as a practitioner now, you know, until you feel like you have a good mastery of a particular modality and what it's really good for. That's when you can start really branching out and expanding the things that you feel like could also benefit, that you don't necessarily have access to in the way that you would like with the primary modality. So for example, acupuncture is incredibly good with moving blood and inducing nerve conduction, moving electrical activity in your body, moving blood, moving fluid. It's so good for that, reducing inflammation. Those are incredible things that acupuncture can provide to just about everybody. Then if we take massage into the picture, massage does such an incredible job of actually releasing the muscle tissue in a way that is more comprehensive than what acupuncture tends to do. It's not that acupuncture doesn't release muscle tissue, it does, but massage is working on all the insertion points, it's working on the flow from one muscle to the next, and how that kind of domino effect will happen in the body. So there's something really beautiful about incorporating massage in with your acupuncture, because it works on, you know, this kind of muscle focus, whereas acupuncture works a little bit more on a blood flow and nerve focus. Massage works a little bit more on the muscle focus. Again, they have overlap. They both work on all those things, but it's just where do they shine? Then we have something that we're using in our office that we call nerve reboot therapy. It's a microcurrent. And so there are a number of things that you can do with microcurrent that don't exist with the other two. Microcurrent takes the frequency that the brain is utilizing when it is going to heal a particular condition. Back pain, as an example. There is a particular frequency that your brain goes through when back pain is in the cervical vertebrae around the neck versus when it's in the lumbar vertebrae around the lower back. So if your brain is actually connected to this cervical vertebrae, then it's going to have a much better effect at healing that tissue damage, right? Or inducing the chemicals that your body needs in order to heal that specific area, which is different than the lower spine. There's actually a different frequency that occurs. And so when we think about what the brain is responsible for, if you have chronic pain and the brain gets to a place where it fatigues because it's trying to heal that neck, 3 weeks go by, 4 weeks go by, 3 months go by, still a problem. At some point, all of that induction of those chemicals and molecular activity that is needed to heal that tissue stops because the brain goes, this must be as good as it's going to get, right? There's a certain point where it's just not going to keep trying every day to heal. There's other responsibilities that we have in this all the things that are going on up here. So what nerve reboot therapy does is it reactivates that relationship. So it says, okay, we're going to do acupuncture to move blood. We are going to do massage to get the muscle tissue to relax. Then we're going to use the nerve reboot therapy to connect the brain, reconnect. It's like dialing up the phone number. Like, oh, I forgot the phone number. It must, and now it's like, oh, that phone number was this. Now I got it. So now we're going to get the brain to reconnect to that area to start really activating some of the healing mechanisms, some of the chemicals that are needed, and the cellular activity that's needed to help bring about change. And so that's the third thing. And then the fourth thing that we do that's so important is herbal supplements and vitamin supplements. Because if you take the supplementation, then what you're doing is you're supplementing. That's what supplements means, is you're supplementing the nutrient quality, the nutrient density in your blood. So now we have supplements that are improving the nutrient density, the quality of your blood. Then acupuncture takes that high quality blood and moves it to the area that you're trying to get to, along with anti-inflammatory response, along with nerve conduction. Now you layer in massage to relax all the muscle tissue around that area and really open that area up. And then you throw the nerve reboot therapy on and you start to, boom, connect the brain to that area as well. You now have 4 different modalities that are all doing something slightly different, but very important what the difference is. Because the other pieces can just, it's like they're turbocharged because you're utilizing more than one thing, all towards healing, but 4 very different ways of approaching it, and that all add value to the healing process. The nerve reboot therapy we've only been using in our office for about a year, and one of the things that is so valuable and interesting about it is the spine was just the example. There's almost 300 different protocols that are built into this machine that are all based off of MRIs on the brain. So they take scans of the brain so that they can see what frequency of activity is going on with somebody who has spine problem, headache, insomnia, gut issue like irritable bowel syndrome, or gallbladder excess, and so even emotions, right? So somebody that's in intense fear or in intense anger, they're taking a scan of what's going on, what the brain is trying to do during that time to help settle that emotion down, and then taking it and mapping that into a frequency. And then when we put the pads on the person, it literally induces and kind of reminds the brain to get into that frequency. We're literally putting that frequency into the body, and now it's like immediately taking the brain to the spot that it needs to go. So it's not just spine, it's internal medicine. I'm using it for digestive issues. It's incredible for sleep. It's great for anxiety. It's been working really well for different specific joint pains. It just has so many different applications. It's been an incredible addition to what we do. Where does a modality shine? That's what we're talking about. Massage shines with muscle release. Acupuncture shines with circulation, nerve conduction, inflammation. So I as much as I want and believe that what we do makes a lot of sense as a first line therapy in so many different instances, to exclude allopathic medicine is crazy. That is so limiting, and for allopathic medicine to exclude holistic medicine is also crazy. They both are working in service of the patient in different ways with different strengths. And when we started holistic health back in 2005, it was so hard to make any connections with medical professionals in the community. It was still so segregated and separate. And now we have so many patients that are doing both, that we see, that are that are on medications, that just had a surgery, that also want to get acupuncture, and they want to take supplements. It's totally, we are very good at managing through some of those things. Just because you're on medication doesn't mean you can't take supplements. You just have to work with somebody that can help you be on the right ones, that aren't going to interact, and knows what they need to do to help you with that. And then it's very safe. It's very, very safe. A lot of what we do is so safe with people that are on lots of different medications. We treat a lot of the senior population, no problem, incorporating supplements with them. There's so much that we can do as a team. And it's one message that I really love to get out there to patients, that we are very pro your health. Whether that's what we do, whether that's working with your primary care, whether that's both, we are pro your health. And I would say the same thing to any medical doctor out there as well.